Hello, I am Monique Prince, and this is my presentation on tuberculosis for the One Health, One Medicine course. Tuberculosis is an infectious disease that is caused by the bacteria known as Mycobacterium tuberculosis. And tuberculosis usually attacks the lungs, but it can also attack other parts of the body like the kidney or the spine. But in these other parts, it is usually not infectious. Here you can see a map of the incidence rates of tuberculosis in 2014, and it shows that the largest number of new tuberculosis cases occurred in the Southeast Asia and Western Pacific regions, which accounts for 58% of the new cases globally. There are two general types of tuberculosis and related infections, and these are the latent tuberculosis infection and the actual tuberculosis disease. Latent tuberculosis infection is when a person has the tuberculosis bacteria in their body, but there are no symptoms, so they do not feel sick, and so they cannot pass on latent tuberculosis to others, but those people are still at risk, and they can have the active tuberculosis later on, especially if the immune system becomes weakened, such as through another illness like HIV infection. With the tuberculosis disease, people have the bacteria within their system and it becomes active, and so the immune system becomes weak, causing sickness. Tuberculosis is spread when the air becomes infected with droplets containing the Mycobacterium tuberculosis, and tuberculosis is spread through the air by coughing, sneezing, talking, or even singing. There are a few misconceptions about tuberculosis spread, and according to the CDC website, tuberculosis is not spread by shaking someone's hand, sharing toothbrushes, sharing food or drink, kissing, or even touching bed linens or toilet seats. But rather, it is spread when a person breathes in the tuberculosis bacteria, which then settles in the lungs and begins to grow. Symptoms of tuberculosis disease in parts of the body depend on the area affected and where in the body tuberculosis bacteria is growing. Usually it grows in the lungs. This is called pulmonary tuberculosis. And in the lungs it may cause symptoms such as chest pain and signs like coughing up blood or sputum. So there are two tests that can be used to detect tuberculosis bacteria in the body, and they are the Mantoux tuberculin or a tuberculosis skin test, as well as the tuberculosis blood test. With the Mantoux skin test, it requires 2 visits to the healthcare provider. On the first visit, the test is done by injecting a small amount of fluid called tuberculin into the skin, and within 72 hours, the person has to return to the healthcare provider and they will look for a reaction on the skin. There will be a hard raised area or swelling, and depending on the size, it will be either classed as positive or negative. A positive skin test only tells that the person has been infected with the bacteria, and it does not distinguish whether the person has latent tuberculosis or has progressed to the disease. You will need other tests such as the chest X-ray and sample of sputum to determine whether they have the disease. You can also conduct blood tests to check for tuberculosis, which is called interferon gamma release assays. People who are at risk are usually those who live or work in high-risk settings, and also people with diseases that weaken their immune systems like HIV, or people from a country where tuberculosis is common. Tuberculosis usually affects adults in their most productive years, but all age groups are at risk. So, to prevent contraction of tuberculosis, the BCG vaccine can be given, and it provides an excellent form of protection against tuberculosis. In regions where it is widespread, also we can have measures to prevent further spread, such as education that tells people how to properly clean and sterilize areas, train healthcare workers from the administrative perspective. And also people with tuberculosis should be taught correct respiratory hygiene so that they do not pass on tuberculosis to other people. To manage people with tuberculosis, a list of drugs have been approved, and so they should finish their medication as it has been prescribed. Patients diagnosed with active tuberculosis should be continuously monitored because even after completion of the treatment, they may still remain at risk for complications. In summary, regarding the One Health, One Medicine, we should continue to emphasize the link between people, animals, and the environment in order to better and also to encourage greater collaboration from medical professionals across different fields of medicine and health as we seek to manage this disease and decrease incidence worldwide.